Why use art therapy? First of all, children project their memories, their thoughts, their feelings, and the understanding of the world onto their art. And this is a way that they can explore with a therapist to see how they're doing. And it's also a way for them to safely travel back to previous events and deal with difficult memories and difficult experiences. Also, art is very kinesthetic, and if you think about whether you're crumpling paper or taking a paintbrush and dabbing it on the canvas or paper or pounding on clay, there's a real physical aspect to working with art that resonates very deeply with children. Also, on a neurological level, art has been shown to help with the reprocessing of memories in the brain and to help people to move toward healing. Also, art allows children to enter a world of fantasy, which is absolutely critical to their healthy growth and development. And also it gives them a chance to engage in wish fulfillment. Because if we think about children, they have very little control over their environment. And this is a way that they can have some sense of control. Also, and most importantly, art therapy helps children and adolescents to reconnect with themselves. And it's been demonstrated that it helps them to build increased self-esteem, increased confidence, and also decrease the likelihood of symptoms related to depression, to anxiety, and to anger. Okay, so we use a variety of media when we're doing art therapy, and basically they serve different purposes. Media such as pencils are very tight. There's a lot of control in the use of a pencil, and that works really well with people who are possibly highly emotional and at risk of becoming dysregulated. And then as we move to crayons and markers, the medium is a little bit looser. Then you get to painting with brushes, again, even looser. And then when we get down to items such as clay and finger paint, it's really loose. And that is something that we want to use with clients and children when we want them to emote more. And you can think about that, right? If you're working with a pencil, it's very constricted, very controlled. You get to these finger paints, you just kind of smush them all over the place. Also, therapeutic art is not about doing representational pieces. We don't set up a vase and flowers and say, here, do a pretty painting. It's all about basically expressing at a very deeply emotional level. And some of the best therapy is through the creation of the abstract, just where we allow the client to work with the colors and the shapes. And also, colors, the aspect of colors are really important to children in that they can assign different emotions to the different colors. And at the same time, we cannot expect to know what each color means to them. So for example, if I say the color red to you, what it means to you, one of you might be different than it means to somebody else. Red might be anger to one person and love to somebody else. Okay, also, art gives children a voice. Children have a limited vocabulary, and they express themselves through play and creativity, as everybody in here knows when they work with children. And through art, they have a way to express themselves without words. And sometimes, even when they're very verbal, things have happened to them that are just too difficult for them to put into words, or they may be tired of talking about it, and they want a way to express it without having to engage people in conversation. Also, art operates on a spatial matrix, so that it's very different from everyday communications and language. And basically, because it's on the spatial matrix, it allows us to communicate on multiple levels at the same time. That's really, really powerful. I think that's one of the most powerful aspects of doing art. And through art, children and adolescents can also use metaphor. They use symbols and metaphor to express themselves. So, for example, if you were to ask a child to draw a picture of their family, they might use animals, they might use monsters, they might use other items to represent the people. And we can use that information to help in our work with them. Also, the process of art can be very meditative, and it can be used to help them to get into their very deep thoughts and feelings and help them, with trauma. And also, it's been suggested by some of the research that doing art therapy helps to increase resilience in children. And what it does is that it helps to increase their self-awareness, their social and problem-solving skills, their emotional understanding, their self-regulation, compassion, and empathy. So it's very, very powerful on multiple levels. Also, the great thing about art is it can be done as an individual, it can be done in groups, it can be done with families. And it gives us, as their practitioners and providers, care providers, a way to observe how they interact with others, and then if they're doing family therapy, how they interact with their family members, how they impact the family members, and also vice versa, how the family members are impacting them. As children progress in art therapy, it can also be used as a way to assess. It shows us where they've been and what they've accomplished. Okay, so behavioral concerns. Okay, art, or rather anger, verbal and physical acting out, and also feelings of guilt are items that can definitely be addressed in art therapy. And guilt is anger turned inward, so still dealing with anger, just anger toward the self. And anger in children and adolescents is often a cover for depression, fear, insecurity, low self-esteem, sadness, and lack of identity. And virtually all of it stems from having a sense of no control over their environment. And also, when we couple that with not having the coping skills, it's a recipe for some of these behaviors to come out. So fantasy, the aspect of art that includes fantasy, provides them for a way to cope with their difficult situations. It can give them a mental timeout. And it also helps them to appropriately channel their sadness and their anger and their stress. Not only that, but as I mentioned before, when they work through the materials, they can manipulate it. There's a physical aspect, that kinesthetic quality. If you're angry, you can literally pound and play. And also, they can use it to generate their own creations and basically show the world what they're feeling in a very safe way. In addition, for children who maybe are having a hard time with anger, it can be used to help teach them how to communicate assertively rather than show their anger. Okay, so with insecurity, low self-esteem, and similar behavioral problems, art helps the children with their identity formation, their self-concept, and their self-image. And that's really, really important. It may be one line, but it's powerful stuff. They begin to have a chance to identify who they are and where their place is in the world. Art has been used for years to help people deal with trauma. And as we know, there are many sources of trauma, ranging from domestic violence to physical abuse to separation, accidents, natural disasters, and so on. And again, as I said earlier, oftentimes children just don't want to talk about it, and this is a way for them to deal with what they've been through. Also, in many situations, for example, when there's sexual abuse, they are given a message either directly or indirectly not to talk about it. Either they're told, we don't discuss that, this is a family secret, and this is a way for them to be able to address that kind of trauma. It's also a gateway activity that provides them with a manageable environment so that they can explore these frightening situations and begin to process what's happened to them. It can also be a way for them to safely dramatize the events. And with hyperactivity and impulsivity, again, it helps them to channel their energies in a kinesthetic way. It also helps them to connect with their bodies so that they begin to make that relationship happen, in such a way that their brains can understand a little bit more, what's happening as they work with media such as clay and finger paints. It also helps them to practice making choices, which is essential to gaining a sense of oneself. For most people, the act of creating art is calming. It's relaxing. So for children who are hyperactive or engaging in impulsive behaviors, it may actually help them to calm down, and the benefits are very similar to those that we ascribe to anger. For the withdrawn child, again, they don't have to talk. They can just express themselves through their art. And also, we might encounter a child who doesn't want to talk, but once they begin to do the art, they might open up and start to talk with their therapist or the person who's working with them. And it can help them to tune in and be present with their bodies. For autism, it allows the child to be in the moment. They can focus on the process of their creation. They can explore without words. And it's so important for us to meet the child where they're at. It also helps with physical manifestations. Many times when children have a lot of emotional pain, it's going to exhibit itself physically. For example, they may have problems with enuresis and caprices. They might have headaches, stomach aches, tics, allergies, asthma, fatigue. Of course, if a child comes to us that way, we want to have them examined by a medical professional to make sure that there is no other underlying cause for these symptoms. And they can begin to work through the emotions that are underlying the physical expression. It's also been found to lower anxiety and improve their self-concept. In working with adolescents, art helps them to externalize their challenging behaviors and stresses. It makes it easier for them to deal with their problems. It also allows them to distance themselves from their problems and become an observer. This is something that I actually talk about with a lot of my clients, the idea of taking one step back and becoming the silent observer that's always there, so that they can begin to understand a little bit more what's happening from their choices and their outcomes. Also, teenagers face a lot of discrepancies in their world. They receive messages from their parents, from their teachers, from the media, from the government, from just many, many, many sources. And it helps them to begin to reconcile the conflicts between their own individual expectations and those of the other people around them. It's also non-threatening. Many times adolescents don't really want to talk with adults, and this becomes a gateway for them to be able to explore the items that they have been resistant to discussing. The group works really well, this age group works really well with symbols and imagery as well. It gives adolescents a way to safely explore their identities and their choices. Okay, art therapy with families. It's a non-confrontational approach to working with families. And when we compare it with talk therapy, it gives them a new way to relate to each other that's less threatening. Also, art is the great equalizer. So it doesn't matter whether you're 4 years old, 14 years old, 40 years old, 80 years old. We're not out to do artwork to impress anybody, with our artistic skills when we do art therapy. So the 4-year-old can express themselves just as well as their adult counterparts. When we're working with families, art therapy gives us a way to begin to observe the hidden messages and belief systems that maybe the family doesn't bring to the surface. And it also gives them a chance to practice problem solving. It can encourage a sense of belonging among the family members, and it also becomes a record of the session that the family can go back and look at and say, wow, this is where we were, this is where we are now. Examples of family art therapy include doing a family drawing together, a family collage together, or a family genogram. Some of you know what a genogram is? Okay. A genogram is like a graphical representation of a family. So we show the different family members, who's married to whom, whose kids are whose. And what's really great is that they can begin to work together to see where the alliances are and how they're all interacting with each other. It can be very eye-opening. Art therapy works really well in groups. It can provide support and hope to people who have been without it. It also allows social interaction for children, and it's fun. So this is something they can do with other people. They can work individually, or they can work in groups. And in their group work, they can still do either an individual project, and then they get together to talk about it, or they can all work together on one art project. The therapy that's done in groups with children is generally more structured and directed. We've got a bunch of kids running around. You know, they're going to need some guidance in where they're going with their project. And it's usually centered around a specific theme or population. So let's just say if it was a sexual trauma survivors group for teenage girls, that would be an example. Okay, so these are some examples of art therapy. So this is a picture of collage that was done. Collage is great for exploring dreams and goals. It's very easy to do. It may be less threatening for some people than some other media that we might use. Three-dimensional art is great for creating a safe space. The child or adolescent can store their anger, or they can put in their hopes and wishes. It's a place to hold their thoughts and feelings. And it also would be one example of art that helps to set boundaries, too. It's contained. Play and model magic work really well, again, for physical expression, and it can create a little bit more intense emotion. Model magic is a kind of plastic-based material, and what's nice about it is that it's not as messy as clay, and it also dries pretty quickly within a few hours, so you don't have to bake it or do anything like that. However, I would say that if a child was really needing to express themselves, probably regular clay would be better for that. There's drawing. They can be directed, drawings can be directed, or they can be very loose. Lots of room for interpretation. Painting is less directive, generally. We might give them a specific subject to explore, and then we let them just get to work and do their art. Okay, masks and face castings are a great way for anybody, whether they're children or adults, to explore not only how we see ourselves, but how we want the world to see us. These, you can do masks on something simple like fly play, right? These face castings are much more involved. We put Vaseline all over the face, all the way up into the hairline. And then the person has to lie very still while somebody else wets the casting material, which is used like to do casts like on your arm. And when you wet it in strips, it dries really quickly. So you wet it, gotta put the strips down and start going all around the face. They have to lie really still. All that's left when they're all covered with the casting material that you can see are their eyes, their nostrils, and their mouth. I would not recommend it for somebody who's emotionally unstable. It's because there's a lot of trust. It's a trust-building exercise, quite frankly. It's just the way for one person. So, but masks are a great way to work through identity. Okay, puppet making. With puppet making, of course, you can explore yourself. This is another way to do it safely because you're taking one step back as opposed to you talking. Now you can project through the puppet. And puppets can be anything that's as simple as just like a little finger puppet. You take some construction paper and wrap around your finger and make a puppet, to something more complicated like this one. The word mandala is a Sanskrit word that means circle or wheel. Mandalas have been around for eons in many, many cultures around the world. And Carl Jung, who was a famous psychiatrist, or one of the founding fathers of psychology, he found that his clients would spontaneously create mandalas and that they were very healing. The process of creating them was very healing. Basically, it's a circle, and there are all kinds of things that you can put inside. These are more organized in terms of their designs, but they can be anything. Also, mandalas help to create a boundary, can create a safe holding space for our clients. These are examples of some other expressive activities, and many of them integrate really, really well with art. I happen to be certified in equine assisted psychotherapy, and that can be used in terms of painting on the horses with tempera paint. It's not dangerous to them at all, and just other ways to integrate. You can also see we have sand tray, dance therapy, drumming, psychodrama, and music therapy. Okay. Well, I really appreciate you enjoying your art project. I hope you learned something from it. Thank you for listening to me today.